Hi, my name is Lara Adeyemi. I'm a DMP student at Bradman University. I am currently practicing in Atlanta, Georgia in a psychiatric facility. This video presentation is on stakeholder education plan on my clinical scholarly project. My clinical scholarly project is titled Educating Nurse Practitioners in Promoting Medication Compliance in the Recovery of Schizophrenia Patients through using follow-up management with them. My CSB will be done, which is my clinical scholarly project, will be done at a behavioral health facility in Atlanta. I will be having three stakeholders. My three stakeholders are one, the CEO of the facility, two, the CFO, and the last person will be the medical director. Schizophrenia is a very, very complex medical condition. Due to the complexity of it, it is very important that medication compliance or treatment compliance is done by these patients so that there can be reduced hospitalizations and these patients can live higher quality of life than they presently do now. Globally, there is 1.1% of the world population that is affected by this condition, and 0.3% in the US is affected by schizophrenia. The age onset for schizophrenia is usually at age 16 for men, and it may be a little higher for women. Why am I doing this CSB? This scholarly project. There is relatively low adherence to medication compliance or treatment compliance for schizophrenia patients, and this results into relapses and re-hospitalizations and low quality of life for these patients, and even their families are equally involved. Brief description of the stakeholders and each group's role in the project. The first person I will be talking to that will be my stakeholder will be the CEO, who is the executive officer of this company. He is responsible for the overall company's operation and performance. It's very important that I get his support for this CSP project I will be doing. It's important that I educate him about the treatment for schizophrenia, why medication compliance is very important to decrease hospital rehospitalization and also improve the quality of life of the schizophrenia patients. And this can even be evident in this present facility as we have a lot of rehospitalizations due to non-compliance. So it's very important that you understand this, as this will also improve their review. The next person that will be my stakeholder and the educational role will be the medical director. Luckily, he himself is a psychiatrist. He provides care to these schizophrenia patients. So it is very important that he comes to terms with me, he understands what I want to do, as this is evident that it will improve the overall health of the schizophrenia patients. As a provider himself, he understands the importance of compliance, medication compliance for schizophrenia patients. So he will help me in getting the consent of the CEO and the CFO. It will also it will allow me to have all the nurse practitioners in the facility participate in this educational program that I want to do. The final person that will be my stakeholder will be the CFO. The CFO of the company is the person that is responsible for the overall financial obligations of the company. Providing educational program can be quite challenging in terms of time and even the money that will be spent. So it is very important that he understands my role, what I really want to do when it comes to my CSP project. I will be providing education to my other colleagues, my peers, nurse practitioners in this facility. And before I can get across to all the MPs in this facility, I'll probably need to do this training about 3 times at different periods in order to reach everyone, every MP there. So that is my goal. The CFO can support me by providing lunch. I can equally provide the lunch. It can also support me by providing long-term injections if we need it, may provide also visual signs and even medication pills such like this. As this schizophrenia patient needs medication pills or visual signs to make them to be very compliant. Educational needs for each group. It's very important that I tell them what is going to happen during this CSP project. I'm going to teach them the strategies to improve medication compliance through follow-up communications. I'm going to talk to them about cognitive behavior therapy, where these patients will understand that why we want to understand why these psychiatric patients, schizophrenia patients, are not compliant. So it is very important that we understand what the reason is and not just why they are not compliant. This is what cognitive behavioral therapy we will be getting across to. The other thing is the visual signs, such as the signs, the checklist, or even pill containers and long-term injectable for psychotic and which are antipsychotics. I will also be touching on the support system, because once these patients are discharged from the facility, they go to the society, they live with their family members, they live with their support system. What happens there, we don't really know much of. So it is very important that we touch base, we educate the family support, the providers, caregivers of these schizophrenia patients, so they can help us to make these patients be very compliant with their treatment. The theoretical foundation and conceptual framework underlying my proposed CSP project. I will be talking about three of them. The first one will be the self-care model. The second one will be the biopsychosocial model of the holistic care. And the last one will be the shared decision-making model. The first one, which is the self-care model. This is very important as recovery is accomplished through the efforts of the person involved. It's going to help me to empower this schizophrenia patient, because the treatment is all about them. We're going to educate them, let them know what schizophrenia is, what the symptoms is, what triggers it, because all this is about them. So they need to be empowered, gain more knowledge, know much more about their conditions, so they can take care of themselves. And once they know much more about themselves, they will be able to become compliant with medication and treatment regimen, thereby reducing rehospitalization and improving the quality of life for them and also for the families, because their treatment also involves carrying the caregivers support system along. The next one is the biopsychosocial model of the holistic care. In most cases, psychiatric nurses use the biopsychosocial model of holistic care to manage the care for schizophrenia patients and other mental health patients. This is attributed to the outcome of the disease interaction between the biological, the biomedical, and the genetic, that also includes the social, the familial, and the socio-economic lifestyles of these patients. The last one I will be talking about will be the shared decision-making model. It is very important that I carry along my peers, my collaborators in here, the psychiatric nurses themselves, and even other care professionals such as the case managers. We need to find a model, a common goal, so that we can all share our decisions to help these patients in their overall health. It is therefore important that the psychiatric nurses and other care professionals effectively strategize ways of reducing prevalence of non-adherence to medication in these patients. That is where we are using this shared decision-making model. The plan. What I intend to do is educate nurse practitioners about the importance of medication compliance in psychiatric patients, why it is important for us to always follow up with this psychiatric patient upon discharge from the psychiatric facility. We want them to have a sense of belonging, a connectiveness, to have a feel that they are not alone, so they can be interested in taking care of themselves, which will reduce rehospitalization and improve their quality of life. So the strategies I will be using will be follow-up communication, cognitive behavior therapy. I will be using visual reminders such as signs, checklists, pill containers, and also long-term injectable antipsychotic medication. And I'm not forgetting the support system. A total of 30 patient charts will be reviewed pre and post implementing my CSP project. The period of the project will last about 8 weeks. I will be administering a pre and post questionnaires will be given to the nurse practitioners to know their knowledge on improving medication compliance in schizophrenia patients. Educational sessions will be held in this facility at 3 different times so that I can reach all the nurse practitioners in the facility. I will also make myself available in person via email, text for any questions and for even additional trainings in the facility. I will also make sure that I carry along my stakeholders, the CEO, the CFO, and even the medical director via emails. I'll let them know the stage we are, what we are planning, the progress of the project, so that nobody will be left behind. This completes my presentation on stakeholders video, educational plan video. I have my references attached. Thank you.